All right, future nurses, welcome. We all know how important sleep is, right? For us, and definitely for our patients. So today, we're going to dive into the common sleep disorders you'll see out there in the real world. This stuff is absolutely clutch for your exams and for being an amazing nurse. So, let's jump right in.
So, picture this. Your patient comes in and says this exact line. I have been so exhausted all day lately. I mean, how many times are you going to hear some version of that? A lot. And this little complaint, it's often the tip of the iceberg, the first clue that something bigger is going on. We're going to come back to this case later, so tuck it in the back of your mind. This is where your detective work as a nurse really starts.
And this is exactly why this stuff matters so much. Seriously, this isn't talk about someone needing an extra cup of coffee. We're talking about patient safety, preventing major chronic illnesses like heart disease and hypertension. You know, the big ones. Your ability to spot these disorders can literally change someone's entire health journey. No exaggeration.
Okay, so here's the game plan. We'll kick off with insomnia and hypersomnia. After that, we'll get into the neurological side of things with narcolepsy and RLS, tackle the huge topic of sleep apnea, clear up the confusion between night terrors and nightmares, and then wrap it all up with treatment and, most importantly, where you fit in.
All right, first up, insomnia and hypersomnia. Think of them as two sides of the same coin, the struggle to fall asleep versus the struggle to stay awake.
Well, let's start with insomnia. And listen, the key phrase here is, despite having the opportunity. This isn't you pulling an all-nighter before a big exam. This is when someone has the time, they're in bed, the lights are out, but sleep just won't come. It's a real, persistent problem of initiating or maintaining sleep.
So what does this actually look like in a patient? Well, it's way more than just, I'm tired. You're going to hear about constant fatigue, being irritable, brain fog. And here's where you come in. You're the one who has to connect those dots and think, this could be linked to bigger things like heart problems or high blood pressure. That's the critical leap you need to make.
Now let's flip the coin to hypersomnia. And I really want to stress this. This is not just being sleepy. This is next-level exhaustion. It's the kind of fatigue where even after a full 10 hours of sleep, the person feels like they haven't slept at all. It's this deep, unrelenting sleepiness that just doesn't go away.
Okay, let's move on. Now we're talking about when the nervous system itself decides to throw a wrench into the works. This brings us to narcolepsy and restless legs syndrome.
So, narcolepsy, you've probably heard of it. It's these sudden, overwhelming sleep attacks that you just can't fight. And a really key feature to look for is something called cataplexy. This is wild. It's a sudden loss of muscle control, usually triggered by a strong emotion. So someone tells a hilarious joke, and instead of just laughing, the person literally goes limp. That's a huge red flag.
And then we have Restless Legs Syndrome, or RLS. The absolute dead giveaway for RLS is when it happens. It gets worse at night, and it gets worse when you're resting. Patients will tell you it's this weird, creepy, crawly feeling deep in their legs, and the only thing that helps is moving them. So just imagine trying to fall asleep when your legs are begging you to get up and walk around. It's tough.
All right, let's switch gears to a huge one. I guarantee you will see this all the time in your career. We're talking about sleep apnea, which is all about disordered breathing during sleep.
So what is apnea anyway? Let's get the definition straight. An apnea is when you literally stop breathing for at least 10 seconds. 10 seconds. Now imagine that happening not just once, but over and over and over again all night long. It's a huge stress on the body.
Okay, so there are two main flavors of sleep apnea. You've got central sleep apnea, or CSA. Think of this as a brain problem. The brain just forgets to tell the muscles to breathe. Then you have obstructive sleep apnea, OSA, which is way more common. This is a plumbing problem. The brain is screaming, breathe, but the airway is physically blocked.
So for OSA, the one you'll see most often, what are the classic signs? Well, number one is loud snoring, the kind that shakes the walls. That's usually what brings the patient in. Their partner can't take it anymore. You'll also see that extreme daytime sleepiness because they're not getting any real rest. And you definitely want to keep an eye on risk factors like obesity or even just having large tonsils.
Okay, next up, let's talk about parasomnias. These are all the unusual things that can happen while you're asleep. And we're going to zero in on two that get mixed up all the time, night terrors and nightmares. Getting this right is super important, especially if you work with kids. All right, screenshot this one because this is pure gold for your exams. Here's the difference in a nutshell. Night terrors happen early in the night in deep non-REM sleep. The person might scream and look terrified, but in the morning, they remember absolutely nothing. A nightmare happens later in the night during REM sleep, and you remember every single scary detail. See the difference? It's all about memory and timing.
Okay, so we've talked about all these problems. Now for the important part. What do we do about them? Let's talk diagnosis, treatment, and your role as the nurse in the middle of it all.
The number one tool for diagnosis, especially for something like sleep apnea, is called a polysomnogram. It's a fancy name for a sleep study. Basically, the patient spends the night in the lab hooked up to a bunch of monitors. We're tracking everything: brain waves, heart rate, oxygen, you name it, to get a complete picture of what's going wrong during sleep.
So how do we treat these things? Well, there's no single magic bullet. It's a whole toolbox. Sometimes it's lifestyle changes, and that's where your teaching skills are huge. For OSA, it might be a CPAP machine. For other things like narcolepsy, we might use medication. And for insomnia, something like cognitive behavioral therapy can be a game changer. Your job is to be the coach, the educator, the support system.
All right, pop quiz time. Remember our guy from the beginning, the 52-year-old? Let's recap. High stress, put on some weight recently, sleeping terribly, and the kicker? His partner says his snoring is out of control. The wheels in your nursing brain should be turning right now.
So, putting all those clues together, what's your number one suspicion? What sleep disorder is screaming out at you from this list of symptoms? Go on, think about it for a sec.
If you are thinking obstructive sleep apnea, ding, 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 you got it. The loud snoring, the weight gain, the stress, it's a classic presentation for OSA. This is a patient you will see 100%.
And there you have it, a quick guide to common sleep disorders. Hey, if this helps clear some things up for you, do me a huge favor and hit that like button. Share it with a friend from your study group. And definitely subscribe, because we're putting out more of these explainers to help you crush nursing school.
Oh, and one last thing. I know the NCLEX is always looming. If you're studying for it, check out the links down below. We've got some awesome summarized